I really love the co-creation approach because again, AI is not like, oh, we have the top-notch data scientists here, so they're going to come up with a great idea and it's going to work. No, you really need to start with, do I understand the need? Do I understand what decision the clinician is trying to make at that point? Do I understand, for example, the patient's condition? What has happened before? Do they have a prior treatment or not? So you really need to understand the whole clinical workflow, the holistic decision making, to make sure that you're creating the right solution for the need, and it cannot be the other way around.
Hello, and welcome to the Frictionless Experience podcast, where we lay waste to digital friction. I'm Chuck Moxley.
And I'm Nick Palladino.
Today, we're excited to welcome Dr. Tina Manoharan to the show. Tina has been the Vice President Global Leader of Data and Innovation at Philips, and before Philips served in product and AI leadership roles at Siemens Healthcare for 16 years. Now, in this episode, Tina is going to discuss with us digital and AI innovations in the healthcare field and how AI can both remove and add friction to digital journeys. Tina, welcome to the Frictionless Experience.
Thank you. I'm excited to be here.
Well, we're excited to talk to you. Now, you have the distinct honor of being our first guest to record this episode from another continent. Tell us where you're joining us from today and how you ended up living there.
Oh, that's nice. That's nice. I'm actually based in Germany. I'm calling from, a place called Erlangen. I don't think many would know, but the closest, let's say, bigger cities are Nuremberg and Munich, if you know that. So, hey, and where are you guys?
So I'm in Phoenix and Nick is in Atlanta.
Yep. Okay. And I have the Nuremberg ring right here as a poster on my wall. I love it. I'm a big race fan. Got to be the most storied track of all time.
Okay, perfect.
Well, and fun fact about Munich, my wife and I were traveling in Munich at the same time, but didn't know before we knew each other. And we ended up over there in the same city at the same time, and we don't know if we ever crossed paths. We met like a year later. So Tina, give us some ideas of what areas you and your team have been focused on for the past couple of years.
Yeah. This is the exciting part. We do a lot of data-driven and AI-based innovations. I would classify that in two parts. On one hand, it's really the customer-centric innovations, meaning solutions for caregivers or care providers like radiologists, oncologists, cardiologists, and so on. And on the other hand, we also do a lot of, let's say, internal business value chain improvements. Let me give a couple of examples, right? If that helps. So if you think of caregivers, especially from a radiology perspective, how can you have, let's say, more precise diagnosis for an individual, extracting the relevant information from the images, really making sure that you're not over-treating or under-treating the patient, you're really having a precise diagnosis. So that's an example of an AI innovation. Another one, let's say after treatment, unfortunately, the patient did have to go to an ICU, and you want to make sure that you're monitoring their condition and they can go home early. There also, we have AI-based insights to really make sure the condition is not deteriorating and you're intervening at the right time. So nurses can really make sure they can monitor their patients, right? So that's what we do. And on an internal business improvement, I can think of various things. So first of all, it's even to understand our customers, right? What their usage is like, what is driving their, let's say, the usage, or why they're not able to use some solutions. So we have insights to really improve upon and deliver according to their need. Another one could be like sales forecasting with AI. You're looking at the best campaigns that we should be, let's say, promoting our solutions to make sure you're reaching the right target audience, right? So that's a couple of examples, but I'm sure we'll explore more as we talk.
Yeah, no, I think that was great. So you talked about what I think the proper term would be provider journeys for the healthcare professionals. We talked about your B2B buyer journeys. So that's them buying from Philips. What about some patient journeys? What are some examples there?
For patient journeys, of course. First and foremost, when we are developing the solutions, you have to put the patient at the center of it, because ultimately a clinician or a physician is making a decision or a patient management decision for them. So we really make sure that the patients can have like a better journey and experience when they're with their physicians, right? And that could be in terms of, for instance, getting their, let's say, reports and results right away after a scan, for example, on their mobile devices, or in other words, getting assurance for, let's say, am I taking care of myself well, like a sleep apnea device or a home-based device that they can really monitor and say, am I doing everything I can for managing my own health? Do I need to go to a physician or not? So we really assist also with that.
Got it. So lots of different audiences.
Mm-hmm.
Yeah, and I find this whole AI inclusion in healthcare to be really interesting, because you're going to start hopefully diagnosing in a more concise and accurate manner. Doctors are always great in their own expertise and their own experiences that they've created over the years, but that's nowhere near the data set that AI can bring. And so it's really exciting to hear a lot of these possibilities.
And ultimately, it's about empowering individuals, right? I mean, again, you and I, we are very interested in digital solutions, the digital experience. Having, for example, today you have all your bank details at your fingertips on your mobile device, and you're able to do everything there. But it's not the same with healthcare, right? You don't have your, we call it 360 degree, your holistic information at your fingertips, and that would be great. Or when you go to a physician, to be able to say, oh, look, this was my treatment the last year, these were the outcomes, I have it, here's a result, quick recap. You're prepared for that conversation. That's the kind of digital experience we also want to bring for patients.
There's actually a ton of talk about that for decades now, because I remember working with some companies way back when I lived in Atlanta, which is like 3 cities ago, where this idea of digital patient records, and you would have, as a consumer, you'd have a single digital patient record that would be accessible by all the doctors. Did that ever actually come to fruition? Is that a thing? Because as a patient, I'm not aware of it.
Well, it's still very complex, right? I mean, there are also pockets of good examples. It also depends on countries, depends on implementation. So if you think of, for instance, US, there's the EMR companies are doing a great job to have a holistic patient record. Of course, there's a long way to go. For example, when patient goes from one state to another state, do I have continuity of information? Or, for example, if a patient goes home and is using wearable devices, now do I have insights from that? Of course, there are still pieces of information missing, but it's a pretty decent job. On the other hand, I've also been to countries like in Spain and so on, just like you go to an ATM machine and you put the card and you get your data, the same way they can actually plug in their ID card, the health ID card, and get let's say the latest status, like in an automated machine, and before they enter into the hospital. I mean, that's not everywhere, right? And I can imagine also in China, especially having patient data on the mobile is also very big. So they're also implementing a lot of different kind of solution over there that enables or empowers individuals better, even to look at maybe the insurance status, am I covered, am I not? So those kind of things. Maybe on a last note, what I was particularly thrilled, I mean, so far in Germany also, it takes a while. Especially with digital solutions. But I was really, really thrilled when I went to my physician a couple of weeks ago, and typically they print out the prescription, and I have to take the printed copy to the pharmacy to buy my medicine. And I was thrilled when they said, oh, here you go, no printing, it's all, on your card, I'm like, what's on my card? And they're like, oh, the prescription is on your card. You just have to go to the pharmacy and just give them the card. They know exactly what to give you. I'm like, no way. And I was so thrilled. And the lady at the, the nurse at the GP's counter, she was like, why is she looking so thrilled, Well, I was. Step by step,
Your passion in this area is so endearing. I love hearing this.
Okay, great. I'm glad.
You touched on all the different countries, right? Because you're implementing your solutions around the world, and you deal with so many different regulatory things. What specific challenges have you faced integrating AI into healthcare devices and solutions when it comes to things like regulatory compliance and patient privacy, and country to country?
Yeah, I mean, that's the biggest challenge, especially when you're a company like Philips or Siemens and so on. We want to offer like global solutions. Making sure that you have equitable access to care. Now, that makes it challenging because you have different regulations, and especially with AI, since it's a changing area, the regulations are not settled. Even the regulatory bodies are learning. So it's our duty as well. We participate very much in shaping these standards and sort of assisting them. Having said that, it's still very challenging. We have to follow the US, for example, the FDA guidelines, and in Europe now you have the EU AI Act, which is first of the kind, but also something we need to understand, comprehend, put the right processes in place. And then if you want to take solutions, for example, to other countries like China, then you also have local like NMPA guidelines and so on in place. But what does that mean, right? I mean, on one hand, it's following the regulations, but the important thing is the underlying concept holds true in the sense you want to make sure that you're empowering individuals to make better decisions, right? You're making sure that there is transparency, how you're coming to the results. You're making sure that data is acquired for creating the AI in a privacy and compliant manner. You are making sure that security aspects are put in place, right? So underlying, it's all for the good of the individuals, the patients, the caregivers. So it's all for the good of the individuals. So that's the underlying theme, and it's our joint responsibility to make sure that we adhere to that. So it is complex. There's a lot to do, but if you really think of the principles why you're doing that and really put measures in place step by step, then it's doable, right? And we are doing it for a good reason. Maybe that also links to your question you asked earlier. Why are these solutions not there yet? Because obviously getting access to the data, making sure it's compliant, putting all the governance in place, it takes time. It's not like some other industries, or it's not like even our own internal processes, right? So for example, when we're trying to improve AI, for example, in supply chain, making a better resilient supply chain, or AI for like sales and sales forecasting, I mean, there, in some way, we can say a lot of it is our own data. That's different from actually getting access to patient data in order to be able to create this clinical value for them. So yeah,
It also
different
feels
challenge.
like the industry, the healthcare industry in general, would have a higher level of maybe risk or exposure to a bad model. So if you go and you create, you have great data, you have a bad model, and it's kind of pulling from the wrong spots, that's going to potentially create a you know to the truth of our podcast name, a frictionful experience for the patient. So
And the data is also not the same. Every individual is different, right? So the data points might be different. Data is different by countries. For example, maybe the clinical guidelines. Maybe in one country they're using a particular diagnostic procedure, but in another country maybe they're using a slightly different guidelines, a European guideline where maybe a different procedure is recommended, or maybe a medication that is not locally available, but it's a slightly different, comparable, equivalent medication, right? So the data is also not the same. Plus, you have differences in individuals. So you cannot say, I trained the AI model on patients in the US and I'm going to start deploying in the Asian market, because even as simple as the organ sizes are different, the individual's height, weight, and so on, they are different. So you really need to understand the clinical scenario, retrain the models as appropriate, and hence you need a very good data and AI strategy to start with before you start saying, okay, I have data, or let's create an innovative AI model. That's not how we start.
yeah, it's very interesting. There are a lot of parallels. We had a conversation with Naveen Gunta from American Eagle, and this was a retail application, but his responsibility was to be able to provide an international experience for American Eagle that is custom to what they would say where the eagle lands. So it sounds very similar where you're taking all of these models and you can't just say one size fits all. And in your world, it's way more specific to physiological aspects that just frankly are part of humanity.
Yeah, physiological guideline differences. At the same time, maybe even the devices, like the diagnostic devices differences. When we build AI solutions, we cannot say, oh, it will work only with Philips devices, right? So we have to really make sure, because a hospital, it's their ecosystem. Maybe they have some of our devices, some devices from another partner. We have to make sure it works with the data, not data tied to a particular device. It's an open ecosystem and vendor neutral solution, which also makes it challenging.
I think it is interesting. And Nick, you were talking earlier about more accurate diagnosis, because I immediately had the picture. Don't ask me why I thought of this, except that maybe my daughter is rewatching. What's the hospital drama that takes place in Seattle? At Seattle Grace Hospital. I can't remember.
Grey's Anatomy.
Grey's Anatomy. Grey's Anatomy. Yeah.
Why did I know that? I shouldn't know that.
Don't mistake, I'm not a fan of the show, but what I do recall scenes are when they have some complex, somebody's presenting with symptoms that they can't figure out what's wrong with them, and they've got all these big medical journals up. They're going back and looking at all these prior cases of diagnosis. That was immediately what I thought of, where AI could be super interesting, where if there's a way to build all these bridges and a model based on all these millions or thousands of diagnoses, it should do much better, right?
Absolutely. What comes to my mind, I mean, typically, when I'm talking to some really senior top-notch clinicians, of course, they have a lot of experience, right? So they say, hey, where AI would really help me, I mean, not in the let's say the basic things or the routine things, which I've seen a lot, which is indeed very good to expedite and elevate my administrative burden. But where they say is, if the AI can learn from diverse data from different institutions, maybe we haven't seen enough of those patients. Maybe we only have 1 or 2% of those specific rare conditions or those specific type of patients in my institution, or what I have seen in my years. And if AI could learn from that and then help assist me, give me ideas, that would be super helpful, right? Another example which I've heard is typically like oncology and so on, you have like a multidisciplinary tumor board setting. In other words, all the disciplines are looking at the patient to make sure you are making the best well-informed decision about the patient. And sometimes they tell me one of their concerns is they don't know what decision was made in the past and what the outcome of the decision was for all those patients, right? Did they have side effects and so on? Yes, they know maybe what might be best for this patient, but they don't know, okay, what was the outcome for the others? Were there any side effects? Were there other complications? If we knew that, we can really make a better decision for this patient that I'm looking at. So there's a lot of areas like that where AI can really be of advanced help, and those are the areas we're also trying to target and tackle.
Yeah, so what you're telling me is that one patient 30 years ago, you couldn't remember that's the only time you've ever experienced that one little thing. Like it's so interesting to me to think about what the possibility is to just be able to effectively crowdsource your results, because then the outlier is no longer the outlier for your practice. It's really exciting opportunity for us as a direction to be able to use AI. I hear a lot of appropriate uses of AI, and this feels like it's the best one.
Yeah, and talking about your theme of frictionless, right? I mean, this is I like the word, and in the sense that's what we also try to do. AI is not about, let's say, hindering them in doing their routine clinical workflow. It shouldn't be a distraction. It should really be part of their clinical workflow. It should be well integrated. Those are the other aspects we need to take into consideration, that we are not creating any bias ourselves in their decision making, but it's really transparent how we came to that results, how they can use it so they don't make mistakes. So those are elements to take care of from a design and user experience point of view.
It's almost mind-boggling. So Tina, you've worked for some very large and established enterprises. How do you foster innovation within all the various teams, especially when integrating, cross-disciplinary technologies like AI and VR into healthcare solutions?
Absolutely. I mean, I like that because I really love the co-creation approach, because again, AI is not like, oh, we have the top-notch data scientists here, so they're going to come up with a great idea and it's going to work. No, you really need to start with, do I understand the need? Do I understand what decision the clinician is trying to make at that point? Do I understand, for example, the patient's condition? What has happened before? Do they have a prior treatment or not? So you really need to understand the whole clinical workflow, the holistic decision making, to make sure that you're creating the right solution for the need. And it cannot be the other way around. We never start with, oh, let's look at what data we have and let's create a great AI algorithm. It's not like that. So as such, you have to really co-create with all the stakeholders, and that typically means including the clinicians who are making the decisions. And sometimes it might be the nurse coordinators who are preparing the information for the clinician. So you have to take them along because they are actually preparing things as well. Or it might be like the patient itself, because imagine a clinician is having a conversation, providing the decision to the patient. How can they actually explain in a way that the patient understands, right? So you want to observe that as well. Like, what is it the patients, what do they want to hear? What are the options? How do we explain the options, right? Using the AI results as well. So you really want to take every discipline, but that's from let's say the clinical domain use case point of view. But internally also, when we build our solutions, we have clinical experts in our staff, right? We do have like medical officers in the team who sit with the team, and we also bring in, for example, market leaders, sales leaders, because they are bringing information from a wide variety of hospitals. That's what we need, right? Because we don't want to co-create with one or two hospitals and things that we can generalize. So we want that. And we do have strong clinical collaboration partners. You want to hear their voice. So yeah, it's really multidisciplinary, different stakeholders you take into consideration. It's a team sport, like we say.
I think you just summarized one of my big frustrations with AI in a really concise way, and that most AI solutions out there to me feel like marketing. And this isn't in the healthcare industry. This is just generally speaking, like AI is just you're slapping the letter A and I on anything, and you're creating a marketing campaign about it. But all of these solutions are starting with the data and saying, what can we do on top of this with AI, rather than starting with the solution and saying, what data do I need? And I think that fundamental difference is where we're seeing good applications versus weak applications of AI. And I think that's going to help me really articulate that going forward.
Yeah, absolutely. So that's where we talk about, having a strong data and AI strategy always begins with truly understanding the need and then working backwards from there. Hey, talking about the need, and again, going back to your frictionless, I'm, one of the things that when you're co-creating, especially with digital and AI, right, you cannot think of the time frame like literally now. Like, what's the time frame? Because you want to enable the co-creators, stakeholders to think about the future state and then work backward from there. In some of the cases, you have to really think, what is my North Star? What is my target state? And the target state might be a year or 2 years from now, and it's not always like, what is the current solution that I immediately need? You need to be future-proof. That sometimes is a challenge for people to think about, how is this AI now going to completely change my workflow or the process? So that's also an interesting part of having this different stakeholder view.
Yeah, that thought crossed my mind as you were talking about it, that this is not going to happen fast. These advances, when you think of healthcare and you think of all the people involved, and then you put on top of that the regulatory, the privacy issues, it's going to be a long evolving process. But the value of it long term, to Nick's point, versus, just sticking AI on a, hey, I can word this email better, in something much more simple that can be rolled out quickly. Can you share a specific example from your past where you successfully eliminated a significant friction point in one of your digital journeys?
Well, when we talk about friction point, I mean, there are a few things that come to my mind. So, of course, one of the key things we heard right in the beginning, right, where physicians were, of course, resistive also to AI, where, they thought, okay, is that replacing me? Or, hey, I have a lot of experience. Why do I need the AI? So, of course, we had those frictions as well. That was like years ago. And now I think the understanding has really changed. It's like, it's augmenting me, it's helping me, and it's sort of also helping me with my administrative burden. For example, it's prioritizing the tasks for me based on the complexity of the case. So I'm paying attention to the right thing at the right time. Or let's say it's automating some of the processes, like I have to create a report after I do the read of the image, or after I do the surgical procedure, I need to create a documentation summary. AI can actually assist in automating those aspects, and then they can do a quick check to say, okay, is it good? So it's like they reviewing, but a lot of, let's say, the draft is there, right? The initial sort of impression is there, and those kind of assistance they start appreciate. And then the other complexity, which I said, is imagine if you could get insights from training with other locations and other data types, right? Maybe I haven't encountered those kind of patients, other similar patients like this. How can I use those insights? So those are like also some of the complex cases. And ultimately, AI also, there are some things you just cannot see with the naked eye. Like imagine like an early tissue characterization change, being able to see that in an MRI image. It's not easy to visualize everything. So now AI is sort of assisting already and saying, look, there is a change there, and pointing in the right direction. Those are kind of areas that they see as augmentation of their own expertise and knowledge, and that's sort of really helping. So that's one of the friction. I think with time, it got better. And the other one is really, the whole co-creation approach makes it comfortable for all stakeholders that their viewpoints are taken into consideration when you're building the solution, right? So they feel like, yes, they understand me, and they understand my workflow. They want to make sure that the solution is the right point in my workflow. It's not like, boom, it's popping up somewhere with an alert saying, hey, look here, I have an AI risk score here, right? So, these are the kind of things they really appreciate when you co-create with them. Of course, then another dimension of friction we've kind of overcome is also internal, right? I mean, of course, there is a lot of various understanding of AI knowledge and AI savviness. There's also friction between the data engineers and the AI, where, let's say the data engineers are like, you don't appreciate what you're doing. Without data, you don't have your AI. We need to make sure that there's high quality data. So really making sure that everybody in the organization understands that data needs to be structured and so on, because sometimes people don't even structure that. So every role, of course, I can give, it'll take a long time, but I can give examples of each role sharing their point and frictions, but together, it's a transformation. So together, we try to communicate that message and really take people along in this transformation journey.
I find it interesting that a basic human response to AI is this going to replace my job? If a doctor questions that, or physician questions that, because, it's a common answer to developers or to, customer service workers or any of these people. So I think that must be a innate human fear or something about the technology.
I mean, some part of the fear, you can say, I take a simple or one or two simple examples, right? If you think of like Uber, in the past, people used to call those taxi call centers, book a taxi, but that's not there. Like Uber, everybody's like, so of course maybe the call center job is gone. Or if you think of banking, right? We used to go to the bank to get to some of those bigger transactions done and so on, but now you can do everything online or on your mobile, right? So some of those jobs have been changed. So yes, there will be a change. The question is, it doesn't mean you literally, let's say, replace different roles, but it's like, how are you transforming and shaping and adapting yourself? And you got to be agile. How are you learning to use the AI for your benefit and upskill and uplift yourself to a, let's say, a stronger role, a stronger strategic role? So that's what I would say. So it's not as simple as ignoring some of the concerns. Some are valid, but how do you help them transform their roles?
That's a good way to put it. And it made me think, one of my early jobs, I worked at a company called Telecheck. I don't know if you remember this, but back in the day, when you would write a check, you had to get it cleared. The cashier would have to call in and give your account number and make sure you weren't somebody passing bad checks. And I was the person sitting there taking the information and saying that check is approved or calling the police. And I'm sure that is a job that's completely gone.
That's right. So, yeah. But you transformed yourself, right? And that's the beauty of it.
Thank
goodness I'm still not doing that job. Yes.
I think one way that we should really look to the past to understand this question is when automation started just becoming the big theme of every business is automate, 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 automate. And all it did was create experts that were more excellent and could do more and be more efficient. So the best way to protect yourself in this mentality of thinking, hey, is AI going to replace my job? Maybe if you're one of the laggers in your industry, it might replace your job. But if you're a leader in your industry and you're being innovative and you're being collaborative, you're not going to be replaced. You're just going to be able to use AI to be better.
So, Tina, what's a commonly held belief about delivering frictionless digital experiences in healthcare that you fundamentally disagree with, that you think people get wrong?
Well, I think I touched upon a few things, like please don't start with, hey, what data do I have? Let's create the AI for that. So don't start with like the typical tech innovation push. Really start with a customer-centric view. What is the need? And then work backward from there. And backward meaning understanding the value flow or the flow of the value and understanding the data flow, and then thinking of what is the right AI solution for that, right? So that's one thing, I think it's now very common for everybody. The other one is whatever solution you're creating, it should be well integrated in their clinical workflow. So don't think that, oh, I have a great AI solution. Boom, let's bring another device, or let's plug it in somewhere because it's so cool and it's AI, they're going to use it. No, you got to understand the processes, and it has to be as the part of the workflow that they are having today. Having said that, another one maybe I disagree with is sometimes people think, okay, whatever I do manually today, I just automate and that's AI. No, actually, it might change the whole workflow. And that's why you got to understand the workflow, well, maybe since I gave the example of Uber, the workflow is different. You're not waiting for a taxi, to take you somewhere. You actually just, boom, you're changing the workflow. You're actually digitally calling for someone. You know exactly how long it will take. You know what you have to pay. Everything is already paid with a credit card. Your workflow is different. So the same way, don't think literally, oh, I'm just going to automate what is there, because that's sometimes what I hear. You got to really think, how is the experience of the individual going to be? And does that change the workflow or the process? And you got to change that, and it's for the better.
So one philosophical question that I contemplate myself, where does automation end and AI begin, in your view of what AI is?
Well, for me, it's more than automating something, right? So for example, automating in the clinical sense, it could be like, AI going through the different scans and saying, okay, here's your prioritized work list. This is how you should read in this order because of the complexity of the case and whatever, right? Or urgency. Now, that's, you could say, automation. Now, AI is much more than that. It's like it can also go to predictions or forecasting, right? Which, for instance, now it's read through the image, it's assisting you, it's even showing you like I was saying earlier, from an MR image, look, there is a change in the tissue characterization, and I'm quantifying the information for you. Now that it's already predicting, is there a likelihood of an early indication of a disease or not? Or maybe predicting, look, you're looking at a particular patient, but there are other, similar patients we have seen, and based on the treatment you've given for the other patients, these are potentially the complications you could anticipate for this treatment. Now, here's some data that you can use to determine what is best for this patient. Now, that's another kind of insight it's giving you. Or like a forecasting could also be, well, if you do this treatment for this patient, it could say, for instance, the likelihood of the patient responding to this treatment might be so and so percentage, but the patient could really have this severe complication, and that might be another information that you're getting to make a decision, right? And maybe there's a likelihood of this patient going into a shock or going into sepsis, So you're getting some. So for me, the beauty of AI is much more than automation, right? You're getting some insights that are actionable well in time, because it's prediction well in time, that you can actually actionable, meaning act on it, right? And intervene at the right time to make sure you're making a better decision. So that's where we need to get to.
Some great insights, because that is a debate that Nick and I have had all the time about what's the difference between automation, machine learning, AI. There's all these, crossovers and close lines. I actually think your example on Uber, I think the best friction that was removed in that process was actually the payment part, because it's always a pain when you're in a cab. You arrive, and if you get stuck in traffic, you arrive and you're late for your meeting, or you're trying to get out, and now you got to figure out whether you're paying in cash, paying a credit card. They're trying to scan your card. They're doing all that stuff. That, to me, was always one of the friction points I hated about cab rides.
Or the cab ride where you get to tell them, now with Uber, you can optionally select no conversations.
Yeah.
It's too early in the morning. I don't want a conversation.
That's true. And music choice and temperature choice. They've really tried to take all that friction out. Well, this has been a great conversation, Tina. And I think what's great, and I hope that the audience could take away while we've been talking about healthcare, everything you talked about could be applied to really any industry. I think there's great takeaways for everybody. So thank you. This is great. Where can listeners connect with you, find you, like on social media? What's our best channel?
Well, I'm active on LinkedIn. That's what I use the most, and I love going for conferences. I love learning. I like listening to people from other backgrounds, because AI is one area you can constantly learn, right? I mean, there's so much going on out there. So I would say LinkedIn is a good place to start, and maybe we will see each other at a conference or two. You never know.
You actually speak at a lot of conferences, right?
Yes, I do. I love it. So for me, it's always a bit of both. I love sharing what I learn and what I know, because I feel somebody can benefit from that. And I always like to listen to the others and have a couple of takeaways for myself.
That's awesome. Well, hopefully some of our listeners will be able to connect with you in the future. So thanks for tuning into this episode of the Frictionless Experience. Remember to follow us on your favorite podcast player app so you can automatically receive notifications when we upload new episodes. And of course, leave a review on Apple Podcasts to let us know what you think and what topics you want us to cover in any future episodes. We'd be happy to cover those or anything that might be causing you friction. And of course, please follow and connect with me and Nick on LinkedIn. I'm at Chuck Moxley, and Nick is
at In Palladino.
Today, Tina highlighted how AI is transforming healthcare by enhancing patient care and experiences and streamlining clinical workflows. To recap, here are 3 frictionless ideas to take the smooth path to trust and loyalty.
Number 1, start with a customer-centric approach. Always prioritize the needs and experiences of patients and clinicians when designing AI solutions. This ensures the technology truly adds value to the healthcare process. When done right, AI technology can play a pivotal role in removing friction within the healthcare systems. by offering precise diagnostics and monitoring insights and enabling a more personalized approach to patient care. Number 2, focused on data integrity. Invest in maintaining high-quality, comprehensive data sets. The accuracy of AI's insights and predictions depends heavily on the quality of the data it analyzes. A crucial aspect of AI in healthcare is the ability to augment rather than replace the roles of healthcare professionals. Understanding clinicians' and patients' needs is essential in developing effective AI solutions. Number 3, encourage cross-sector collaboration. The development of impactful AI solutions in healthcare hinges on the quality of data and the collaboration among various stakeholders involved. Healthcare providers, technology developers, and regulatory bodies must work closely together. Collaboration is crucial for overcoming the challenges of AI implementation and ensuring the solutions are effective and compliant.
And on a final note, stay informed about the latest developments in AI in healthcare. Continuous learning and adaptation are key to leveraging AI's full potential in improving patient-centered healthcare outcomes.